Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Blepharoplasty, eyelid surgery. Introduction. Eyelid surgery repairs sagging or drooping eyelids. The surgery is also known as blepharoplasty or an eyelid lift. This program explains eyelid surgery. It discusses the procedure as well as its risks and benefits. The skin and the eyelids. The skin is the body's largest organ. Skin protects us against heat, light, injury, and infection. Skin also regulates body temperature and stores water and fat. As we get older, our skin changes. It starts to wrinkle, lose its elasticity, and sag. Smoking and exposure to the sun speed up the changes in the skin as we age. These changes can lead to facial wrinkles and sagging skin. Our face is the first thing people see and notice. It shows our expressions, feelings, and personality. Women's faces begin to change at an earlier age than men's. This is because women's skin is thinner and does not have as much blood supply. Changes usually start in the early 40s for women and the late 40s for men. Your eyelids help protect your eyes. When you blink, your eyelids spread moisture over your eyes. Blinking also helps move dirt or other particles off the surface of the eye. Closing your eyelids when something is coming towards your eyes can protect them from harm.
The skin around the eyelids may start to sag as people age and as the muscles weaken. Fat that normally stays in the area around the eye can move forward below your eyes. This may cause the area above, around, and below the eye to sag. The space below your eyes can accumulate fluid. This can make the area under the eye look puffy or swollen. These changes can make the person look tired and can make it hard to see.
Facial cosmetic surgery. The decision to have cosmetic surgery should be made by you and your healthcare provider. Work together to make an educated decision about whether the surgery will be safe and effective. The healthcare provider needs to evaluate your general health and find out what you expect from facial surgery. He or she will then examine your eyelids and your face. Your healthcare provider may recommend one or more specific facial cosmetic procedures. You should have realistic expectations about what cosmetic surgery can do for you.
You should also understand the possible risks and complications, as well as the cost of the surgery. Your health insurance might not pay for the procedure if it's done for appearance only and not because of vision problems or for other medical reasons. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Eyelid surgery.
Eyelid surgery is a procedure to repair droopy eyelids by removing excess skin, muscle, and fat. You may decide to have the surgery if sagging eyelids prevent your eyes from opening all the way. Your lower eyelids are below the normal position. Drooping eyelids are affecting your vision. You feel like you look older or tired.
Alternative treatments. Alternative treatments to eyelid surgery can also reduce eye puffiness, bags under the eyes, and drooping eyelids. Applying cold compresses or sleeping with your head raised can help reduce or eliminate puffy eyes. To naturally reduce eye puffiness or sagging eyelids, avoid salty foods, drink lots of water, get enough sleep. Skin treatments such as chemical peels may improve skin tone and tighten the skin. They may lessen the appearance of puffiness and tighten the skin around the eye. Skin resurfacing is a procedure that is less invasive than eyelid surgery. It removes damaged skin and boosts the production of collagen around the eyes. Botox can be used to improve facial wrinkles. It can also be used to reduce the sagging of the lower eyelids and raise the upper eyelids. The procedure. Eyelid surgery rarely requires a hospital stay. The surgery is often done in a surgeon's office or as an outpatient surgery in a medical center. It may take between 1 and 3 hours to complete.
An eyelid lift is usually done while you are awake. A cosmetic surgeon will numb your eye with a shot of medicine. Medication may be given to you intravenously to help you relax. You should not feel pain during the surgery. To reduce scarring, the surgeon will make an incision along the natural crease of the upper lids. The incision on the lower lid will be in the crease right under the eyelashes or on the inside of the lid. Loose skin and some muscle and fat beneath the skin are removed.
The incision is closed with tiny stitches that leave a nearly invisible scar. Sometimes surgical tape or skin adhesives are used instead. Stitches may follow the lower lid's natural crease. They may be placed inside the lower eyelid. Risks. As with any surgery, eyelid surgery carries some risks, such as infection or a reaction to anesthesia. Most healthy people don't have any problems with anesthesia. Although many people have mild temporary symptoms, anesthesia itself is very safe. Complications of anesthesia are rare. They happen most frequently in older adults or people with serious medical problems. Complications include temporary mental confusion, lung infections, stroke, heart attack, death.
Other possible risks of eyelid surgery include temporary numbness of the eyelid skin, dry or irritated eyes, temporary vision changes such as double vision, impaired eyelid function, scarring, damage to the muscles of the eye, a very small risk of blindness due to bleeding behind the eye. Your healthcare provider can explain the risks and benefits of surgery in more detail.
After the procedure,
you may be allowed to go home the day of surgery. A lubricating ointment will be applied to your eyes to protect them and prevent dryness. You may have blurred vision, double vision, and watery eyes after the procedure. Bright lights may bother you. Your incisions will be red and visible at first. It can take at least 6 months for the scar to fade. Your eyelids may be puffy and numb for several days. If stitches were used, they will be removed after 3 or 4 days. Swelling and bruising will likely last a week or more. Ice packs or cold compresses held to your eyes can help reduce swelling. Sleep with your head above the level of your heart.
Pain after eyelid surgery is usually minimal. You may be given a pain reliever for mild discomfort. Do not take aspirin, ibuprofen, or naproxen. These medications may increase your risk of bleeding.
Do not lift anything heavy or do intense exercise after surgery. You should not swim. Wear sunglasses outside for protection from wind and sun. Avoid smoking before and after surgery because it makes complications more likely.
Follow your healthcare provider's instructions. He or she will teach you how to cleanse your eyelids. You will be given antibiotic eye drops or ointments to prevent infection.
If you have chest pains, shortness of breath, or a change in your heart rate, seek emergency medical attention. Also, contact a healthcare provider right away if you are bleeding or if you have trouble seeing. Eyelid sagging may happen again at some point later. Some people achieve permanent results from surgery. People are generally satisfied with their appearance once they are fully healed. If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary.
Eyelid surgery is a procedure to repair droopy eyelids by removing excess skin, muscle, and fat. The surgery is also known as blepharoplasty or an eyelid lift. You may decide to have the surgery if sagging eyelids prevent your eyes from opening all the way. Your lower eyelids are below the normal position. Drooping eyelids are affecting your vision. You feel like you look older or tired. Eyelid surgery rarely requires a hospital stay. The surgery is often done in a surgeon's office or as an outpatient surgery in a medical center. It may take between 1 and 3 hours to complete.
As with any surgery, eyelid surgery carries some risks, such as infection or a reaction to anesthesia. An eyelid lift is usually done while you are awake. A cosmetic surgeon injects medicine around your eye to numb it. You should not feel pain during the surgery.
Do not lift anything heavy or do intense exercise after surgery. You should not swim. Wear sunglasses outside for protection from wind and sun. Avoid smoking before and after surgery because it makes complications more likely. Follow your healthcare provider's instructions. He or she will teach you how to cleanse your eyelids. You will be given antibiotic eye drops or ointments to prevent infection. Thank you for using Explain.